Uh, this is a very busy time of the year for us as we start to gear up for Medicare open enrollment. And we wanted to just kind of go over some things so that you can be prepared for open enrollment. And so the next slide, please. So what is MAP? MAP is the Michigan Medicare and Medicaid Assistance Program. We're one in 54 state health insurance assistance programs, and in Michigan, it's just called MAP. We offer free counseling services, and we assist individuals with Medicare and Medicaid and their caregivers to help them navigate through their Medicare benefits. And I'm going to say our number now, and I'll say it again at the end. It's 1-800-803-7174. Next slide, please. What will be covered today? We'll be talking about the Medicare open enrollment period, Medicare Part D, and Medicare Part C, also known as Medicare Advantage plans. We're going to talk about the website where we can either help you or you can go to medicare.gov and do that yourself. You're going 2 slides ahead. Could you go back 2 slides, please? Well, there we go. And so we're going to talk about how you can prepare for open enrollment. Next slide. So the Medicare open enrollment period is October 15th through December 7th. This is the time when you can review your Medicare plan options. You're going to start seeing a lot of commercials on TV. You probably start getting a lot of information in the mail from your current plan. This is when you can change your Medicare drug plan or Medicare Advantage plan. And all changes will take effect January 1st. You do not have to change if you don't want to. So if your current plan is working for you, you're happy with it, and you received like a notice to say that your premium is not going to increase or it may increase, this is just an opportunity for you to see what else is out there. Next slide. The Medicare open enrollment period. What changes can you make? You can join a Medicare Advantage plan, also called Part C. This combines your Medicare Part A hospital, your Medicare Part B medical, and your Medicare Part D drug plan. You can also join a new Part D prescription drug plan, which just covers your medications. Or you could switch from your original Medicare to a Medicare Advantage plan, also called Part C. If you switch from a Medicare Advantage plan, I'm sorry, I can't see the rest of that slide. But if you switch from a Medicare Advantage plan to original Medicare, you would go and have to sign up for a prescription Medicare Part D standalone drug plan as well to make sure that you have coverage. Some Medicare Advantage plans do have Part D and some do not. But I don't think in Michigan we have Medicare Advantage plans that no longer carry Medicare Part D. Go ahead. Next slide. The Medicare Part D. Medicare Part D prescription coverage is a standalone prescription coverage that can be added to your original Medicare Part A and or Part B. And it's offered by private insurance companies that are approved by Medicare. Now, premiums, copays, and deductibles may apply. The Medicare Part D drug deductible for 2022 is going to be $480. In most cases, you have to meet your deductible before the plan kicks in or before the plan starts. Some individuals do have what's called LIS, low income subsidy, or extra help to help pay for their medications. This would lower your copays and it would waive your deductibles in most cases. Currently, right now, there looks like there's about 23 Medicare Part D drug plans that are available for us in Wayne County. Next slide. Medicare Part C, as I mentioned, is the Medicare Advantage plan, which combines your Medicare Part A hospital, your Medicare Part B medical, and your prescription all into one plan. And these are usually HMOs, health maintenance organizations, PPOs, private provider options, HMOs, and POSs. And we have very few PFFSs available for us in Michigan. There are currently about 67 Medicare Advantage plans available for us in the state of Michigan. Medicare Advantage plans offer some additional services that's not covered up under original Medicare, such as dental, vision, hearing. Some of them offer transportation. Most of them offer some type of physical, like silver sneakers or some type of a discount for LA Fitness exercise programs. Again, they are offered by private companies and approved by Medicare. Some of them do have monthly premiums. You will pay those premiums in addition to your Medicare Part B monthly premium cost. And you do have copays, and the $480 deductible will still apply unless you have extra help. And just so you know, if you guys have any questions, you can type them in the chat and we'll address the questions at the end. Next slide, please. So we use the site Medicare.gov, which is the official US government site for Medicare. And in that site, we can walk you through how you can create a My Medicare account for yourself. And when you create a My Medicare account or you call us, in order for us to see exactly what you're currently enrolled in and whether or not you have extra help, we would need to create a My Medicare account for you. We use the Medicare Plan Finder to compare your Medicare plan options and to enroll you. And then with the My Medicare account, it, like I said, not only gives a personalized search, but with that, you can also see, you can request a replacement Medicare card. If you didn't receive your insurance card, or you can get your drug plan information out of there and request another card or print a card for yourself. You can also use that to review your Medicare summary notices and see what your doctor has charged Medicare for services that you receive. Now, if you don't want us to create a My Medicare account, that's perfectly fine. But that means that we will only be able to conduct a general search. And that means that we may not see, we won't see your current plan that you're enrolled in. We won't know whether you have extra help. And then we'll have to list your medications again. Once you create the My Medicare account, it should already have like your medications and things like that in there. Go ahead. Now, how to prepare for open enrollment. In last month in September, you all should have received what's called an annual notice of change or an evidence of coverage. This is when you get to review any plan changes for the upcoming year. This will show if your plan premiums are going up, so if the cost has increased, the benefits coverage rules, and the plan's formulary list of drugs on your plan. So say last year in 2021, your plan may have covered all of your meds, but in 2022, they're no longer going to cover some of those meds. You may have had a 0 monthly premium if you had a Medicare Advantage plan. This year, that premium might be $50 or $60. The same with your prescription drug plan. So that annual notice of change or evidence of coverage would have are required to let you know of all of those changes. If you are choosing a Medicare Advantage plan, you want to make sure, a new Medicare Advantage plan, you want to make sure that you contact your physicians and specialists to make sure that they do participate in that plan before enrolling. A lot of times, if you're speaking to an agent to enroll in a plan, they'll look at the provider directory and you'll see that the doctor or provider is in that plan, but doctors and providers go in and out of network all the time, but that directory is only done once a year. So say at the beginning of the year, your doctor said, yes, I'm going to participate with Blue Care Network. In March, they decided they no longer want to participate in that plan. In April, you're signing up for Blue Care Network and they say, yes, your doctor's in here, but your doctor may not be. So that's why it's always, we always suggest that you check with your current physicians and specialists, because when you join a Medicare Advantage plan, especially if it's an HMO, you can only see those doctors and providers in that network. And also you want to make sure that your drugs will still be covered in that plan for next year. and that the pharmacy that participates with your plan is still in network. As I mentioned, people go in and out of networks all the time. Next slide. Now, you want to look out for enrollment fraud. Again, it's that time of the year where a lot of people will sign you up. So insurance brokers are not allowed to call, email, approach you in person to market plans unless you invited or requested them to come. So the only mail and things that you should be receiving in the mail is from your current Medicare Part D provider or your current Medicare Advantage plan. Your current Medicare Advantage plan can tell you about new Medicare Advantage products that they have. They can talk to you about supplemental Medigap options and things like that. The same with your prescription drug plan. So say if you're enrolled in a WellCare prescription drug plan, Silver Springs cannot send you marketing material because you're not enrolled in them. Okay. And also, plans cannot rush you into an enrollment. The open enrollment period is between October 15th and December 7th. You can use the entire time to allow you to make a decision. If you sign up for a plan and this plan sounds good, but then you hear about another plan and you think that plan sounds better, you can still change that. The last enrollment is the enrollment that counts, and that will be effective January 1st. So you still can change your plan, your mind. Plans cannot offer free items or gifts on the condition that you enroll in their plan. Next slide. Also, you want to be careful and make sure that insurance brokers do not enroll you in their plan without your permission. So a lot of times you will see advertisement and commercials and they'll say, we can help you get $100 a month in your plan. When you're calling these individuals that you see on TV, they collect your personal information, your name, your address, your Medicare information, your date of birth. So right there, they have everything that they need to automatically enroll you in that plan. If you're just calling to gather information, you do not have to provide anything other than your name. As I mentioned before, they can do a general search for you to let you know what your options are. Please do not give out your Medicare number. I can't tell you how many times we've gotten calls from people who provided all that information, and the next thing they know, they're enrolled in a plan that they didn't select. Okay, so again, just as a reminder, be careful not to share your personal or Medicare information with anyone calling on the phone claiming to be from Medicare. Medicare does not do cold calls. They will not call you. The only time Medicare will call you is if you put in a request for a call back from them. The only time that we will call you at MAP is if you've called us. Social Security will never call you unless you put in a request to call. So be mindful of that, especially during the open enrollment period. And again, those commercials. If you want to know if you're eligible to get money back in your check, which is called the Medicare Savings Program, you can give us a call at MAP. Again, that number is 1-800-803-7174. I will mention it again at the end of this, and then we will also type it into the chat for you. Next slide, please. So I know I said a lot of information, and it is the open enrollment period, and it kind of went pretty fast because I know usually during open enrollment period, you guys have a lot of questions. But you can contact MAP again, and we can help you compare your plans. We can help you enroll in prescription drug plans. You can make an appointment to speak to a MAP counselor, either over the phone, or we can do a Zoom chat. Unfortunately, we're not doing any on-site visits due to the pandemic. When you call to make that appointment, or if you want to make an appointment with either MAP or any of our partners, you must have a correct list of your medications and your Medicare information to enroll. You can ask us about, as I mentioned before, low-income assistance programs where this helps lower the cost for your Medicare Part D prescription costs. And it also works with your Medicare Advantage plan. So it could lower your Medicare Part D cost for generic medications to $1.35. And for for your brand name medications, depending on the level you get, if you get 100% subsidy. If you get a partial subsidy, then you would pay $3.95 for your generic and $9.85 for your brand name meds. So just think about, you may qualify for this program, and a lot of people don't really know that they qualify for this program because they don't inquire. We can help you apply for that application, and in about 15 to 20 days, it will make a difference. So if you think you may be eligible for that extra help, again, you want to give us a call at 1-800-803-7174, and it takes us, we can do the application, and then in about 15 to 20 days, you'll receive notice from Social Security Administration if you have been approved for extra help. Next slide. Oh, we're at the question slide. I guess I kind of went through that pretty zippity. I guess we can open it up for questions.
If you're on mute, you are able to unmute yourself, or please type your questions in the chat.
You may also, while we're waiting on questions, you may also be eligible for help with what's called the Medicare Savings Program, where you can get help paying for your Medicare Part B premium. And that will put an extra, well, right now the Medicare Part B premium is $148.50. We won't know what the new premium will be for 2022 until like maybe around November 1st. But you can get that money put back in your check if you meet the requirements.
Donna, what seems to be the major scams that our seniors are experiencing around this time?
So a lot of times, some people will call and say that in order to get enrolled in your plan, we need your Medicare number, or sometimes they'll charge them a fee. A lot of times they do, I think, what is called spoofing, where on your caller ID, it'll appear to be Social Security Administration. So that 1-800 number for Social Security shows up, but it's really not Social Security. As mentioned before, Social Security Administration will not call, but they'll call and say, oh, well, we're issuing new Medicare cards and we need to get your banking information so we can verify where your deposit goes. They're really, really crafty. Or they'll call and say, we need your Medicare information so you can get your telehealth service. Well, if you're getting telehealth service, your doctor already knows your contact information and that information, so you don't need to share any of that. Again, as mentioned, a lot of times they will offer, have like come learn about Medicare breakfast, and you'll go to certain places and they'll give you a tour of the facility with an elaborate breakfast. And when you're getting ready to check out, they ask for your Medicare information. And the next thing you know, you're signed up for another Medicare Advantage plan. So again, if you're just inquiring about a product or service, you do not need to provide the Medicare number. Even if you're calling us at MAP, we can do a general search without your Medicare number by putting in all your medication and looking and comparing the plans for you. We will never enroll you into anything until you request that. Or if you are not comfortable with that, you can always call Medicare as well. And they will ask some identifying questions, and they do have the rest of the information to verify that, and they can help you enroll in the plan. So you want to be on the lookout for usually phone calls. And then sometimes they'll put those little like pink or blue, they was pink last year, or pink or blue, and sometimes they're green, and there'll be a little postcard saying, make sure you're getting all of your Medicare benefits. If you could just sign this and put your phone number on there. So that means that now you've given marketers permission to call you and sell their Medicare products, but you just thought that you might have been missing out on some Medicare benefits. If you have not received your Medicare and U-Book for 2022, it does list all of the benefits and everything that you're eligible for. If you're not certain and you think that you're missing out on some benefits, always feel free to contact us at the Medicare and Medicaid Assistance Program at Detroit Area Agency on Aging. Again, at 1-800-803-7174. We have we have 6 different partners also throughout the Wayne County area that can assist you as well. Do we have any questions in the chat that I need to address?
Yes,
sir.
we do have one question in, and it notes that from Daniel, he notes that he has a client. My client has ALMB, QI. Does he need to apply for extra help via SSA, or he will get it through MDHHS?
Okay, so ALMB, for those who are not in the MAP world, means additional limited Medicare benefit. And that's a program where the state pays for your Medicare Part B. That's not a guarantee. So that is as long as the funds are available. And Daniel, if the individual has ALMB, then they should automatically qualify for LIS or low income subsidy to help with their prescriptions. And additional limited Medicare benefit. You should go ahead on and help them apply for LIS with Social Security so that they can go ahead on and get that extra help to pay for their prescriptions. It's not an automatic thing. For Social Security, you would have to apply. With Social Security Administration, it's only automatic if the individual qualifies for QMB, qualified medical benefit.
Thank you. What is the best way to get a good overview of these issues? How can I stay current? And that's from Lee.
When you say what is the best way to get a good
overview of these issues? So it may be if there's some place just that we can refer them to, is it best to call someone? How can we stay current?
Yeah, so they can always, as it relates to Medicare, it's going to be in the Medicare and You book that you received for Medicare and You 2022. They can always call us at MAP if they have questions. And then as it relates to Medicare fraud and abuse, again, you can give us a call at MAP, or you can check our agency's website. You can check the MAP Inc. website. And then what we do is we do put something on our agency's Facebook page, and we do share the information with our partner insights as well. A lot of times they do advertise it on the news and everything like that.
Where can they get a copy of that Medicare and You book?
So you can contact me at Detroit Area Agency on Aging at 313-446-4444. My extension is 5314. We have not received our Medicare and You 2022 books yet, but individuals that have Medicare should have received them the month of September or should receive them before October 15th.
I just received mine last week.
Okay, very good.
Donna, can you verify that I got your extension correct in the chat?
Sure, hold on. Yes, that's correct.
Okay, great.
Any other questions for me? So I just want to say that if you're happy with your current coverage and you don't want to make a change, you don't have to. But sometimes just going to a different pharmacy makes a difference. And just a couple of stories. A few years ago, I had a lady who came in and she was paying $385 a month for her prescription drugs. Nothing changed on her medications. Her plan premiums didn't change, but the pharmacy she was going to was an out-of-network pharmacy. So just by coming in and looking and talking with us, we checked an in-network pharmacy. And before she was paying $385 a month, which only went down to $85 a month. So she saved $300 a month by just checking and comparing and making sure she was enrolled or going to the right pharmacy. So, sometimes those things, it does, you don't have to make a change, but it's also good to just double check to make sure that you're not paying more than you need to for your prescriptions. Any other questions? Ms. Lawson, you got a question for me?
Thank you for asking. I don't have a question. I'm taking copious notes, and I've sent out this information to our, to the caregivers. Well, I do want to know, is this going to be, this presentation, is it going to be on YouTube? Will you have it available again?
Yeah,
Christy?
yes, we will. As long as Ms. Donna says it's okay. We are planning on sending, what we generally do is, so at the end, within 24 to 48 hours, everyone will receive a packet that'll have your evaluation of the workshop. It'll have the recording, any slides that will be shared by Ms. Donna. And I think that is it. We also do plan, we would like to upload this probably on our social media sites, which will probably be our YouTube page, and that information will be there as well. We probably will, we may also, because of the importance of this topic, it will probably be also located on our website, semisrc.org, but we will have all that information linked in the packet that you guys received. So everyone registered for this workshop, regardless if they made it today or not, will receive this information.
And Christy, I'm going to add that is absolutely perfect. And I'm going to also ask that maybe if this information can be shared, so we can also post it on our Detroit Area Agency on Aging website as well.
Absolutely. Absolutely.
Wonderful. Thank you.
Any other questions? I know you guys have some,
Yes, don't be shy.
but just know that we are still available Monday through Friday from 8:30 to 5. Again, at 1-800-803-7174. Now, we currently cover Wayne County, Eastern Wayne County, which is Detroit, Hamtramck, Highland Park, Harper Woods, and the Five Grosse Points. But if you call that 800 number, it will get you to the appropriate MAP coordinator. There are 16 area agencies on aging that do what we do in the state of Michigan. And between Detroit Area Agency on Aging, the Senior Alliance, and 1B, we cover 51% of the state of Michigan. So even if you call the number and you're not in our service area, we will answer the general question, but get you to the appropriate area for the assistance that you need as well. No other questions?
Juan, are there any questions?
Yeah, I do have another question. This is Marilyn Lawson. I was just thinking that this number, so this number right here, I have people who live in different areas, like in West Bloomfield, some that live in Western Wayne County. So if they call this number, will you answer this number, or will it route them, will it look at their area code that they're calling from and route them to that, to the area that would handle them?
So yes, it's technically a smart number, but we do know that people call from cell phones. So if they call from a 313 exchange, they will most likely get us at Detroit Area Agency on Aging. We in turn will give them the direct dial number for the location that services the county or city in which they live.
Yes.
Again, if they have a general question and this doesn't require a lot of
Research.
Yeah, well, research is a good word. If it doesn't require a lot of research, we will answer like general questions for them, but we will still direct them to the appropriate thing. And a lot of times doing open enrollment as well, depending on how busy a county is, we will still help them with an enrollment. We would refer them out to the appropriate site, because that's what we're governed to do for the MAP program. But if they call that person and they can't get through, it's open enrollment. The ultimate goal is to make sure the individual gets the service that they need. So we will still help them, but we have to refer them to the appropriate office first.
Okay, thank you so much.
Any other questions?
I just wanted to say, for anybody that's on the phone that's dual eligible, that has both Medicare and Medicaid, everything that I mentioned does still apply for the Medicare open enrollment. But if you have Medicaid, you do have some other options where you have zero copays and zero deductibles. It's a program called My Health Link, and there are 5 of those that cover Wayne County. And if you have some questions about those or you want to compare the options, you can give us a call. What they do is they kind of enhance some of your Medicaid services. So say, for example, Medicaid, straight Medicaid covers glasses like once every 3 to 5 years, depending on the vision. But if you join one of the My Health Link plans, you have low vision, you may get contacts. They provide transportation. You may be able to get dentures in addition to just regular preventive cleaning exams and x-rays. So keep that in mind as an option as well. No other questions? So everybody are ready for Medicare open enrollment? Yes, very good.
We can hang on, so maybe there's some questions afterwards as we get ready to close out the presentation. But please be reminded that everyone will receive a copy of the recording and evaluation of today's workshop, as well as any slides that we'll be sharing, along with a certificate of attendance. So we want to thank everyone. So if no one has any questions, we're going to keep the lines open for a minute because we do have this presentation running for a while. So just to make sure, sometimes people like to ask questions after the fact, and that's fine as well. And I think Juan may have had some technical issues, so I want to definitely hold on as we get our interpreter back into the room. Making sure that her lines are clear.
I just wanted to also mention too, for anyone who has a Medicare Advantage plan, the open enrollment is October 15th through December 7th. However, if you have a Medicare Advantage plan, you kind of get a second choice for enrollment, which would be January 1st through March 31st. But that's only if you are in a Medicare Advantage plan or a Part C. So you kind of get like a second enrollment option. So you want to keep that in mind too. And it's always wise to do it early as opposed to doing it late. So we can look at and compare options for you now, but we can't do any enrollments or start any enrollments until October 15th.
That's helpful information. Thank you.
Mm-hmm.
So Juan, I know you're back on. If you want to type into the chat, let us know. Thank you, Lee. If there's any questions or additional concerns, we are going to leave the lines open, though we are not hanging up. If people want to hang on and want to chat after the fact, we will be here as well. So if Donna, if you don't have anything else, we're going to officially close out.
Well,
if people want to move on, go ahead.
Before you do that, I also wanted to just mention that the Medicare and You book comes in large print. It comes in Chinese, Spanish, and I did order some audio as well as the traditional Medicare and You book. So again, if you're looking for any of those books or you haven't received them or you need them in those special, those topics like large print or audio, again, just give me a call at the Detroit Area Agency on Aging. And we'll make sure that information, once it comes in, it goes out in the mail to you.
And remember that number for DAAA, Detroit Area Agency on Aging, is 313-446-4444. The number is in the chat as well. 313-446-4444. And did you have anything you wanted to add?
No, I'm just thankful that everyone was on the call today. And I'm sure that as you look over benefits and services over the next couple of weeks, you may have additional information that needs to be answered. So give us a call at the Detroit Area Agency on Aging.
There's a comment in the chat. I think it says from Lily. Hello, I know this is regarding open enrollment. However, we were wondering if we have received any updates regarding hazard pay. I'm not sure if either of you, Donna or Ann, has any answers for this or if there's some further dialogue, and that's from Lily Alvarado.
I'm not sure what she refers to as hazard pay as it relates to Medicare. Could she elaborate a little bit more?
Lily, were you able to come off of chat, or did you want to put it, come off of mute, or did you want to put it in the chat? We are waiting. It's no, we have time.
While she's making up her mind, what I can say is individuals that are new to Medicare and may be enrolled in Healthy Michigan Medicaid, traditionally that would drop off as you became Medicare eligible, but because of the pandemic, they are not closing out those Medicaid cases. So where you traditionally would not have Healthy Michigan Medicaid and Medicare, you still can because of the pandemic situation. So I want people to know that. So if you find that you lose your Medicaid, you can give us a call with that as well, as long as you have Medicare. Okay.
Thank you. So Lily notes this is regarding the care workers with dual enrollment with Medicare and Medicaid.
So again, we don't do financial, so that would not be something that we know, but we do know that care providers did receive, additional pay during the pandemic, which was supposed to be up until September. So I don't know if they've extended that. I haven't seen anything. And do you know anything about that? I haven't seen anything that they've extended that beyond September.
I think that there were some discussions about that, but we can check.
Okay.
And get a more definitive answer.
So what they can do is my email address, if you could put it in the chat.
Yep.
Lily, if you wanted to email me, and if we find out something or we see, if you are a care provider, what I do know is MDHHS does send out bulletins to make you aware of that, but I'll give you my email address as well, and you can send me an email, and if we find anything, then I can forward that information to you. So my email address is my last name, Shellman, D for Donna, at D for Donna, A for Apple, A for Apple, A for Apple, the number 1, A for Apple.org.
Donna, this is Marilyn Lawson again. I just want to ask this question or say something. Sometimes people don't have the question that they want to ask you, but they just don't know about how to go about it. Can they just call you and say, this is what I have, what would be best for me? Or this is what I pay generally for my prescriptions, or these are the services that I have required medically in the last year. What do you think would be good for me as an add-on?
Yes, generally a lot of times we do receive calls from individuals who do not know how to maybe ask the right question. So as they start to talk, our counselors are trained to kind of, we'll repeat back and say, is this what you're looking for? And then we can go over the options. We never tell you what's best for you.
Okay.
All we can do is explore what your options are and explain the difference. So we can compare what you're currently paying as opposed to what you could pay. Like I said, with the other lady who was paying $385, we looked at a different pharmacy. It was $85. It was up to her whether she wanted to switch. Had a similar situation with a gentleman when Myers used to give certain prescriptions for free, and he catches the bus, and he lives in Highland Park, and his doctor's office was next to Myers. So the 2 medications that he was paying $196 for at the pharmacy at his doctor's office, he could have just stayed on the bus a little bit longer and went to Myers and got them for free. He chose to continue to pay $196. So all we can do is put the information out there, and the decision is strictly up to the Medicare beneficiary.
I see. Okay, thank you.
Mm-hmm.
Donna, can you explain how looking at various benefits can really help people leverage all the dollars that they have in their household? And that you sort of spoke to that a little just a minute ago.
Yeah, so again, it's always good to, although you don't have to enroll or change, and you like your doctor and you like the pharmacy that you go to, Sometimes just changing the pharmacy can make a difference in your cost because the pharmacy is in network. So like I said, again, I keep using this example of $385 a month for 12 months is a lot of money, where she turned around and saved that $300 a month by only paying $85. So it doesn't hurt. And then also, as I mentioned before, if you think you may be eligible for extra help to pay for your prescriptions, or you just want to know, you can give us a call and we can go ahead on and screen you for that. And then if you do meet that requirement, then that's a potential savings of $7,000 a year in your pocket for your medication costs. And also you may be eligible for help paying for your Medicare Part B premium, as Daniel was mentioning on the phone about ALMB. A lot of people don't get those benefits because they don't know that they qualify. You got to remember that a lot of things are entitlements. They're not handouts. They're entitlements. So you may be eligible or entitled to a benefit that you're not accessing because you don't know how to ask. When you call MAP, although it's for open enrollment, we will still screen you for the Medicare Savings Program. We will screen you for extra help for your prescriptions. If you have Medicare Part A only and don't have Medicare Part B, or if you have Medicare Part B only and don't have Medicare Part A, there may be some options. We always encourage people that are new to Medicare, before they opt out of the Medicare Part B and say, I don't want to pay that monthly premium, you may be eligible for help from the state to pay for that. And a lot of people don't know it. So if you're getting, your income is $778 a month, $148.50 is a big chunk of money to come out of your check. So then you say, I don't want that benefit. And that's the benefit where most of us use when you go to the doctor, your durable medical equipment, your lab work, but you can get help paying for that. And a lot of people don't know, and they'll just automatically say, oh no, I don't want it because I can't afford to pay for it. So we try to screen them for everything. Although they may be calling us for open enrollment, we still screen them for the Medicare Savings Program, for help with Part B, the extra help for Part D. We've been very instrumental in getting people Medicare Part A who didn't have enough credits to do that. So we will screen you for all of those. We want to make sure that you have all-inclusive coverage.
So Donna, if I give you my personal information, you can just take that and look it up and you can find out what I have done in the previous year. Is that correct?
We can look, once we create a My Medicare account for you, it will show us your current prescription or Medicare Advantage plan. We can also see what plans you've had in the past. We can request a new Medicare card for you. You can view your Medicare status. It will also list your current medications. We go over that list with you to make sure you're still taking those medications. Have any of them been updated? Do we need to delete any of them? Because again, the medications that's put in there drives what your cost is in addition to the monthly premium.
So people don't really have to do any prep work before calling you if they just want to give you their personal information. You can check that out, see what's happening, and you can see, you could tell them that they are entitled to something else, by having that information.
Correct. So when they call, a traditional call to our MAP, on our MAP 800 number, is we do ask for your zip code to make sure you're in our service area. Because all Medicare prescription drug plans, if you're like in a UP, it may be not covered up there, where it's covered down here in Wayne County. So depending on what the caller is calling about, we will answer that question. We would assist with that issue first. And in the meantime, if they're saying, well, I want to change my drug plan because I'm having a little difficulty paying, then we would say, you may be eligible for extra help. When an individual calls, and in regards to just giving us their personal information, Ms. Lawson, we will also need to have a list of their medication, and they will have to give us verbal consent to create a My Medicare account for them so we can actually log into Medicare.gov and see what they have or what they're enrolled in. And then that gives us a better opportunity to see what their options are.
Okay. Thank you. Now that answers a lot, and I can talk to my people about that. In fact, I may call in myself and to test it myself. Thank you so much. Okay.
And we can also walk you through Medicare.gov. A lot of times giving out personal sensitive information you know, with everything that's going on in the world and all of the frauds and the scams, people may not be comfortable with that. So we don't have to do the application for you for extra help. We can direct you to the source, the government source that does that. We can direct you or walk you through the website to do it step by step with you, and you're inputting your own information. And the same with comparing your plans and your prescription drug plans, because our goal is to make sure that the Medicare beneficiary gets what they need most. You know, we're not commission driven. We are unbiased. We don't advocate for one insurance company or the other. All of the Medicare Advantage plans and drug plans have to meet the Medicare guidelines. If they do not, they will be sanctioned. Okay, you may receive a pink letter in the mail saying that your plan is not meeting all of the Medicare rules. And on the back, it'll give you a list of drug plans that you can select, or it'll give you the 800 number to give us a call, or you can stay in that plan. You might just be happy with it and say, well, it don't apply to me and I haven't had any problems. So anytime you receive anything in the mail, as if you have Medicare, it will have our 800 number on the bottom. And if you're not clear what that is saying to you, then you can give us a call. We do get a CMS notification, so we know what letters go out, what they look like, what color they are, what they're talking about, and what should happen from that.
Okay.
Hey, Donna,
Yes.
is that I'm 61 years old, and how old I can eligible get the Medicare support?
So in order to be eligible for Medicare, traditionally you have to be age 65 or older, or you can have a disability deemed disabled through the Social Security Administration. Once Social Security deems you as disabled, you have a 24-month wait period before your Medicare starts. So you would have to apply for Social Security for disability if you're under 65. Now, although you still may be disabled at age 65 or 66, Medicare doesn't consider you disabled because you've aged into Medicare at age 65. And,
Okay.
and then all of the questions doesn't have to be just about Medicare Part D. Any question that you have about Medicare while you have me here is the perfect opportunity to ask those questions as well.
Thank you.
Mm-hmm.
Juan, was there anything? I hope we didn't lose her again. Because I'm wondering, Juan, was there anything? Let me make sure here. If you can put it in the chat.
Let me say, if you have Medicare Part B only and you do not have Medicare Part A because you have not earned enough credits, you want to give us a call because you may be eligible for the state to pay for that for you as well. And again, that number is 1-800-803-7174. And if you didn't write it down, it's going to be on the back of your Medicare and U-Book. And as mentioned before, every letter that you receive, if you have Medicare, it's going to say at the bottom, for more information, call, and it's going to be there as well. I think that number is publicized just as much as 911.
I know what time you put in Urban Aging News, that one page, one sheeter. I think that was just so good. I mean, it's not complicated. You can look at it. If you have Part A, this is what you have, Part B, etc. So I mean, you know, some pictures along with that. Just very simple, and I thought this is great.
Thank you. Chrissy, I think you guys have that flyer as well. And if not, I can get it to you so you can put it on your website.
Yeah, please send it. I was just looking on my other computer. I was getting ready. When she said Urban Aging News, I was like, let me pull up so I can put, for those that may not know, you can actually, there's a paper distribution of it, but you can also go online. And I agree, Ms. Law, it was a wonderful, that the issue was beautiful. Everything was really beautiful in that issue. But if you could send it to me, we'll put that out as well. Sure. Exactly what you like. Absolutely.
And I think the last thing I have, I just, you get off and I said I should have asked this. Is there something that you really need to sign up for when you first become available for it? Because if you don't, eventually when you sign up for it, you're going to be paying more?
Yes, thank you for mentioning that. So just on the Medicare front, when you're eligible for Medicare, you have a 7-month window. And depending when you sign up determines when your Medicare starts. So that you can remember this, we want to call it the 313. 3 months before you're eligible for Medicare, the month you're eligible for Medicare, and up to 3 months after you're eligible for Medicare. Okay, if you do not sign up for Medicare Part B when you're first eligible because you don't think you can pay that $148.50 and you decline it, the penalty for that is 10% for every 12 months that you were eligible that you didn't sign up. So say I was eligible for Medicare January 1st, 2020. And I did not sign up for Medicare Part B because I'm basically healthy. I don't want to pay the $148.50. I'm not doing that. So January 1st, 2021 rolled around, still didn't do it. So now January is coming up again. And I said, well, you know, I need to go ahead on and sign up for my Medicare Part B. Now I have incurred a 20% penalty of whatever the Medicare Part B premium is. So right now that premium is $148.50. So it will be 20% of that premium forever. Okay. Now, the other thing about that is, as I said, when you're new to Medicare, you have a 7-month window. If you don't sign up when you're first eligible at your initial enrollment, then you have to wait till the general enrollment. So remember I said it's January 1st, 2022. So now I can sign up for Medicare Part B between January 1st and March 31st. However, my coverage will not start until July 1st. Okay, but the penalty is 10% for every 12 months. So that penalty would only be 20%. Okay, of whatever the Part B premium is. The same thing with Medicare Part D. If you don't sign up in the 7-month window when you are, then it's going to be 1% penalty of the national Part D drug premium at that time. Now the drug premium for next year, I believe, is $33.37. So that will be 1% of that on top of what you pay for your monthly Part D drug plan. So say I was eligible again January 1st, 2020, and I didn't sign up in my 7-month window period for my Part D. So the next time I can sign up is during the open enrollment period, October 15th through December 7th, and my coverage will not start to January 1st. So that's 1% per month. So now it's 12% of the national drug average of $33.37. And then that drug average changes in 2022 and 2023. It's going to always be 12% of whatever that was, unless I can prove that I had credible coverage.
Okay, you just answered my question. I was about to say, because some people are still working at age 65. And so if you had credible coverage, then you're exempt from that.
Correct. So anyone who works, what I always say to individuals who are eligible for Medicare and still working, sign up for your Medicare Part A because it's free and it doesn't cost you anything. So you already have that. And if you ever have to go to the hospital, then it helps. If you're still working and you don't need to sign up for Medicare Part B, as long as you have credible coverage on your job, you don't have to sign up for Part B or Part D. But when you get ready to lose that coverage or you get ready to retire, for Part B, like boy, you have an 8-month window to sign up for Part B without a penalty. But for Part D, you only have 63 days. So it's a difference.
So is that published anywhere? I mean, that, like, it would be great to have a 1-pager on, everything that you just said, but is that published someplace so you can read that? I mean, where do we?
Yes, it is in your Medicare and U book, and I don't know what page it's on for 2022, but it is in the Medicare and U book, and you can go to the directory and look up penalty, and it'll tell you that.
Penalty, okay. Look up,
or you can look up enrollment, so it'll tell you that as well.
Donna,
Now,
I came across, go on.
Oh, okay, go ahead. I have my thought, but you can go ahead, Ann.
I came across a case where a woman had relocated to the Detroit area because her mother was having dementia issues.
Mhm.
And she found out that it was about 2 years and her mother had not applied for Medicare. Does CMS allow for exceptions when there are medical reasons or other extenuating circumstances where someone may not have enrolled because of Alzheimer's, dementia, or some other kind of medical issue?
Yes, so they have what's called a special consideration. And depending on what the circumstance or the situation is, they can do that. I'm currently working with a person who lost her Medicare Part B premium in May of this year. And as long as they were able to pay it up until current, they were able to restart their Medicare Part B. Now, as for 2 years, and I don't really know, I don't know why it would have went 2 years without, because with dementia, she would have to have some type of medical services. And usually when they get ready to go and activate stuff, then they'll tell them that we don't have insurance or anything like that. I'm sorry, hold on 1 second for me, I apologize.
Just to remind everyone will receive a copy of this recording, associated slides and evaluation. Please complete the evaluation so we can provide that information to Donna and her team, in addition to a certificate of attendance.
One of the other things that I wanted to mention is that individuals that receive Social Security disability and have Medicare because they're disabled, if they're under 65, they kind of get a second initial enrollment. So they get a second option for enrolling in case they missed them during the beginning of their initial.
And that's for someone with SSI, you said?
Yeah, that's for anyone who's receiving Medicare through Social Security disability. So what happens is, and the reason that that's important is because a lot of individuals who are age 65 and older and have Medicare, when you're first new to Medicare, you get a 6-month guarantee issue right to sign up for supplemental or Medigap insurance. That's secondary insurance that can pick up money that's not covered. Medicare covers 80%, and those supplemental plans can pick up the other 20%. That's not covered by Medicare. Now, if you're under 65, they don't have to give you that as an option. And so a lot of Medigap plans don't sell plans to individuals under age 65.
Donna?
So, yes?
Sorry, can you repeat if we apply the Medicare before 65, it's supposed to be like before 3 months. 3 months before 65, we need to apply the Medicare Part B. Is that correct?
Yes, that's correct.
Okay, so which number we should call? Which number we should call for apply this Medicare?
So if you are already have like Social Security income or receiving survivor benefits and you're turning 65, Social Security will automatically reach out to you and you'll automatically receive a Medicare Advantage plan, your Medicare card. If you have no connection with Social Security Administration, you're not disabled, you're not receiving survivor benefits, then you have to contact Social Security to apply for Medicare.
Oh, okay. Thank you.
Mm-hmm. Any other questions? This is good. I also wanted to mention that when you're new to Medicare, you do get a welcome to Medicare exam. Although you may have saw your doctor or seen your doctor already this year and your Medicare is starting in December, you want to go ahead and do that welcome to Medicare exam. And then you get an annual wellness preventive exam. So you don't want to schedule an annual physical. You want to schedule an annual wellness preventive exam. With that, you have no copays And depending on what the service is, very few deductibles and office visit fees.
Donna, do you schedule that yourself or does the doctor schedule it for you each year?
Well, usually you schedule it along with your doctor. But when you, a lot of times, you know, you may be turning 65 and like Ann mentioned, you may still continue to be working. So you may not have your Medicare coverage. So they won't know that you're new to Medicare until you tell them. It's like, hey, I got my red, white, and blue card, and I want to get my welcome to Medicare exam. So although you may have already had a physical earlier that year, you still get that welcome to Medicare exam as well.
Okay.
Are there any other questions or concerns that I can help with? Well, I want to also say that I want to remind everyone who already has Medicare to make sure to read your Medicare summary notice. Your Medicare summary notice comes out to you quarterly if you go to the doctor or if you've been in the hospital. And on your Medicare summary notice, it shows you services that Medicare has been billed for you. So it'll show the date that you went to the doctor. It'll show the service that was done, and it will show what they billed Medicare for and what the Medicare approved amount was, what Medicare paid, and what you may owe. So it's important to look at that. Let me give you an example. My mother has not smoked in 35 years. She has a doctor that comes to her apartment for a home visit, and he was billing Medicare for smoking cessations. And I'm, you know, doing what I do. I'm checking her Medicare summary notes, and I don't check it all the time. I just happened to get the mail that day, and I'm like, "When you start back smoking?" And she was like, "I didn't." And so, you know, we contacted the doctor and told them they need to take it off. We also, you know, reported it to Medicare. So you want to be mindful of that, and that's why it's important, because a lot of times individuals depend on you to not look at your Medicare summary notice because you're so inundated with a lot of mail and stuff. So you don't look at it because you looked at it once, it's like, oh yeah, this look okay. And so you don't look at it all the time because, you know, we trust our providers and things like that. But sometimes people do make errors. It could be billing code issues and things like that. So that's why it's important to look at that. And also with your Medicare Part D, you receive a statement every month to say, this is how much we pay for your medication. This is how close you may be to fall into the gap or the donut hole. This is how much more that we're going to pay. Now, the gap or donut hole means that Medicare has paid, your Medicare Part D provider or Medicare Advantage plan has paid the maximum allowable amount that they're going to pay for your medications. Some people fall into the gap or the donut hole a lot sooner than other people. Excuse me. Grandbaby came home, so she's having some issues in the background. I apologize for that. But your Medicare Part D statement shows that. So you want to look at that as well, so that it'll let you know when you're falling to the gap or the donut hole and when your cost is going to change. As mentioned, some people will fall into the gap or donut hole sooner than others. Individual who has a lot of generic medications may never hit the gap or donut hole, but individuals who have chronic illness will hit it soon. Some people hit it right at the beginning of the year in January. Some people never hit it, and some people don't hit it to September. So you will know when you hit it because you hit it at the same time every year. Any other questions?
Been a wealth of information shared.
Yep. And I'm glad that it's all recorded.
Me too.
Yes, indeed. Juan, I want to make sure we're checking in with you. I know we're kind of going back and forth in chat, so let us know before we close out. Okay, thanks.
again, if you have any questions that come up after this session, or you're not comfortable typing them in the chat, or you're not comfortable asking them, you can always give us a call. We do one-on-one counseling. And everything is strictly confidential. And then like I said, we will compare and go over whatever your best options are. Sometimes the answer that we give may not be the answer that you want, but it's the answer. And we will also provide you resources where you can, follow up and verify that the information that we provided you is accurate and correct. Tell all your friends.
I just wanted to jump in real quick. My name is Chelsea Sostak, and I'm the outreach coordinator for the My Choice Waiver Program at the Senior Alliance in Wayne County. And I just wanted to let everyone know, just because it was a question earlier, I did put the contact information for our MAP department as well. So if you are working with people that are not in the coverage area for DAAA, but are in the coverage area, which is Southern and Western Wayne County for the Senior Alliance, then you can contact those numbers as well, or instead, I should say.
Thank you, Chelsea. We work very close
Of course.
with Carrie and Paul over there. So.
We'll give it a couple more minutes and if it's okay with Donna, we'll shut down at about 12:15. So any other comments or questions, put them in the chat or come off of mute. I want to thank Association of Chinese Americans again for their support and translation. As always, they are amazing partners, and I'm so grateful to have them. And definitely, I'm so grateful for DAAA, always there. TSA as well, great partners for us as well, and many other folk I'm sure on this line. I don't want to leave anyone out, but I just want to say to ACA, Association of Chinese Americans, please, if you want, if you want to put your information in the chat, maybe the phone number and the email, the phone number and the website for ACA in the chat, that will be great.
Hey, Chrissy, this is Donna. While we're on the phone, I know that you mentioned that the information is going to be online. So the translation portion that Han did is going to be in Chinese as well there. Will they be able to?
Now, see, that's what I need to check with Wan about on how that works, because we have not posted any of our translated workshops as of yet. So I'm not really sure how that will work, but I will speak with Wan afterwards to see how that goes. And I'm not sure if there's something different in the recording, but we'll be able to see that once the recording is solidified in Zoom.
We have a the PowerPoint, and I'm not sure if she translated it in Chinese, but Han, that would be something good that you could do. And if that doesn't, you can translate it in Chinese, and then they can maybe post that as well. But we'll have some conversation about that.
Okay, great. And Wan did put her email address in the chat as well. Thank you, Chelsea. Thank you for your information. And Chelsea actually does a series every Wednesday, I believe it is. Am I getting that right, Chelsea?
Yeah. Virtual, it's also through Zoom, a virtual event called Waiver Wednesdays. And it's where I do my Choice waiver presentation. So if you know about waiver, you just want a refresher, or if you're working with people that don't know anything about waiver and they would just want more information, yep, it's every Wednesday at 10 a.m. Unless I'm gone, then I send out reminders that it's going to be canceled. But every Wednesday at 10 a.m. And again, if you want to join, It is free. My presentation's about 15 minutes, so super short and sweet. But again, either if you've never heard of it, or if you just want a refresher or have some questions, you can hop on and join me for that presentation. All are welcome.
Thank you.
Thank you.
It looks like you have a hand up in the corner.
Yes, there's a hand up. Wan, or can they come off of mute?
Looks like she may need to translate that, though.
Yeah, so I'll give her a moment to translate. She's okay. She said she didn't say anything. Okay. No problem. Okay, they lowered their hand. Okay, no problem. All right. All right. With all that in mind, once again, thank everyone for joining us today. Thank you for your patience. I think this went very well. Once again, recordings will be coming out to everyone. Please make sure that you do complete the evaluations as well. We'll make sure those are in Chinese as well for people. Chelsea has put in the chat a link for the Waiver Wednesday presentations. So that is there as well. So thank you, Chelsea, for providing that information to everyone as well. Always remember, we cover this region collectively and collaboratively. So it's important for all of us to continue to work together. And that's one of the goals of the SRC, is to make sure that all those that are aging service providers and those providing services to those with disabilities are collectively providing those services collaboratively without being siloed. Everyone doing their own thing, but we all should be on the same page. So with that, Ms. Donna.
Sorry, I just wanted to add just to that as well. As I mentioned before, there are 16 area agencies on aging throughout the state of Michigan, and we all provide the same core services. So, if you're looking at Waiver Wednesday, but you don't live in Wayne County, they offer the same thing in Oakland County. But it's good to look at so that you'll know what your options are. And then I'm sure whoever you call will direct you to the appropriate county for the services that you need. But all of the AAAs provide the same core services.
Absolutely.
Thank you so much.
Thank you. All right. With all that in mind, I want to thank everyone for today and have a great day, everyone. Wan, I'll connect with you after we hang up. I'll connect with you just so we can make sure we have all the final pieces put together, that we can send those packages out correctly.
And then I'm going to send a flyer to you and to Wan